In the U.S., some hospitals are becoming overwhelmed. 21 states are reporting record daily case numbers of COVID-19 now, and up to 1,000 Americans a day are dying. In hospitals near the U.S. border, among those treating American patients are Canadian healthcare workers. Our Jeff Semple is in Michigan, and he spoke to some of them.
So my name is Niki Walters. I'm a nurse. I'm Canadian living in the U.S. right now.
Before the pandemic, Hillis Walters was living in Canada, working 2 jobs, in Windsor and another at a hospital near Detroit. But when COVID-19 hit, she was forced to pick a side. So she went where the need was greatest.
We were getting slammed with tons of admissions with this virus that no one had really heard of much before. It just really felt like it was the right place to be at that time.
Steve Homick, registered nurse.
Okay, where are you from?
Windsor, Ontario.
Homick is one of 1,600 health workers who live in Windsor but commute cross-border to Michigan.
Obviously have friends in the hospitals in Windsor. It was quite different hearing their stories where there was only a few people in their ICUs at one point, as opposed to ours where we had to literally create a new ICU to house all these patients because it was so out of control. Like 2 different worlds, really.
And another difference, many of their American patients can't afford to get sick.
They were trying to beat it on their own or trying to just to avoid the cost that it would be to treat it, right? So by the time they were coming in, it was like almost too late, right? Because it's like now they're too far gone.
I am Wendy Peterson. I am a Canadian. I am a RN case manager for hospice for a large rural area of Montana.
Brothers Peterson says in her care facilities, she's often the only one wearing a mask.
The majority of the families give me a look. There are comments about masks with the rhetoric that unfortunately the president of this country has made normal. It's hard not to be angry.
But there have also been moments of hope. At the height of the first wave, Hillis Walters looked out the window to see this.
People in this community did a parade around the hospital. They honked and they drove through and they had signs, and local restaurants were sending food. It's an opportunity to come together. And I think that starts with, not seeing myself as like a Canadian necessarily, an American, or just like a nurse helping a human.
A number of those cross-border Canadian healthcare workers told us that at the beginning of the pandemic, they were offered the opportunity to remain in Canada, to ride out the pandemic north of the border. But all of them said the same thing: not a chance. Donna?
So much work to do. Jeff Semple in Michigan, thank you.